Welcome back. I'm Jen Holloway. As we focus on breast cancer awareness, we just heard part of Angelique Newman's story. Here's where her story takes a drastic turn, and a turn for the better. Angelique, welcome back. I also want to introduce our viewers to Susan Shear.
Hello.
She and Angelique met along the way during your breast cancer journey. So let's pick up the story where we stopped off. So you're going through treatment. When did you guys first meet?
We met shortly after I finished my treatment, actually, in a manner of relation between my previous employer. And she told me right away that
she was going to work for me.
That work with you.
But I couldn't afford her.
That was it, absolutely. She couldn't afford me.
Okay, and what did you do?
Actually, I am an oncology nurse, and I worked at a cancer center in the area for about 8.5 years. And I just wanted to help cancer patients and their families navigate everything that I had seen. And so it was important to kind of get out of the system, and I cashed everything in and said, somebody's got to be out there to help these people that know it. And so
you took a leap of faith.
I took a huge leap of faith.
How long had you two known each other?
Not long.
No, 4 or 5 months.
My goodness. The next thing you know, you're in business together, you partner, and now we have
RN Cancer Guides. Yes.
Okay.
And we provide actually the nation's first employee cancer assistance program.
Really?
It's the ECAP, and it is basically a way for self-funded employer groups to control the catastrophic cancer claims that they're paying on. And we have some amazing news. You guys are going to be the first ones to hear it.
Oh boy.
Just yesterday, we filed a 501c3 nonprofit.
Really?
It is RNCG Angel Foundation.
Okay.
And we really found that a lot of the private patients that were coming to us in need were not able to meet the for-profit payments that, running a business requires.
Right.
And we've had some amazing experiences meeting with the very generous philanthropic people of Tampa Bay, but unfortunately did find some resistance in their willingness to donate to a for-profit company, even when it was for the purpose with which our company is. So we made a very drastic decision a few weeks ago to separate the business. So we now have a for-profit corporate entity and a not-for-profit 501c3 where we can provide our oncology certified nurses to all cancer patients who come to us.
So there's no, just because someone can't afford it,
That's correct.
You can still service them. What do you do when you go into the home? When you first meet, how do you get connected with them? Do they call you?
They call us. Sometimes they get referred from the American Cancer Society, or they hear something about us.
Friends, neighbors.
Yeah. And what we do is we go into the home, like for example, you were talking about your father. So we would meet with your father and the whole family and sit down and go, what is it that's important to you? What do you understand about your diagnosis?
And what don't you understand?
And what you don't understand. And are you looking for clinical trials? Are you looking for second opinions? Are you wanting to know what the chemotherapy treatments are? We just disseminate all this information. Because for cancer patients and their families, it's like being on another planet.
Yeah.
And you don't understand the lingo, and it changes on a day-to-day basis. And there's so many different therapies, and what's the difference between stereotactic radiosurgery and CyberKnife, or,
These words are crazy. I can tell you as a patient, it's so hard. You don't grasp it, you don't retain it. And to simplify, to have somebody there to simplify it for you and your family makes all the difference.
All the difference in the world.
And we also make sure that all the providers are talking to each other, and all of our nurses are oncology certified nurses. So they actually go to the appointments with the family and with the patient. So we will sit in there and we will ask questions and engage the medical staff and try to work together as a team so that we have the best outcome possible. And everybody is on the same page. And it's kind of like you would hire an attorney to fight for your life because you don't know the system. It's the same thing with what we do.
Wow, because I'm sure, like you said, you're on another planet. It's a whole different area. So you know the questions that ask and that need to be asked. And not only you do know to ask them, you do ask them, but then you translate what the doctor says.
Correct.
We call it a lot of times the Charlie Brown syndrome. Like it's all of a sudden, you have cancer and everything becomes wah, 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 wah. And it is very hard. I was previously in the medical field. and even having the knowledge that I did, it was unbelievably difficult to navigate the providers, because I can tell you, as a patient, you don't have one doctor. You have 5. You have a surgical oncologist, you have an oncologist, you have a radiation oncologist, you may have a gynecological oncologist, a nutritionist, therapist, psychologist, psychiatrist. There's so many different aspects to the treatment of cancer. It's not having and developing one-on-one relationship with one provider. And having an RN Cancer Guide in your corner gives you just that. You develop a one-on-one with that nurse. And it's actually one of our brand promises, is to provide you with a nurse in the family. And this nurse is available to you 24/7. You can text your nurse at any point in time. You've got her cell phone or his cell phone number. You pick up the phone and call. We have a patient right now who said that being able to call their nurse in the middle of the night literally saved the woman's life.
Wow. It's got to take so much stress off of the patient and the family.
And the family, and really the caregiver, because the caregivers are the ones that are, am I doing things right? I've never done this before. Am I hurting my loved one? Am I not? Am I looking for the right treatments? Am I doing the right thing? And sometimes it's just a matter of, maybe we'll check in and just say, you know, you're doing a really great job. And just to hear that. We also look for resources. So we work with all the groups in the area, and we might, one of the groups that we know has a free peripheral neuropathy clinic. So we can refer there. We'll look for money for drug. We will help with their disability. We will look for wigs. We will look for whatever they need.
Wow.
Well, and one of the things too that's so beneficial about utilizing a service like this is that we're objective third parties. We are not beholden to one specific institution or facility. We're not beholden to one specific insurance carrier. We make sure that the patient is seeing the best of the best for whatever their needs are. And it's really comforting to know that as a patient, maybe my siblings are arguing, thinking I need to do something different. And you know what? One, I can defer that stress and say, call my guide. You guys hash it out with her. And she's going to be able to, you know, we all play different roles. She's going to be able to disseminate the information and to minimize the situation, because me as a patient, I don't have the energy to fight with those things. And so the role of our guides is
it's everything.
It's never ending. It's always changing. And one thing I always say is that everybody's cancer is their own. There are no two cancer patients alike, whether you have the same diagnosis, whether you have the same staging, or whether you have the same treatments. Everybody reacts differently.
Different. That's great.
And our services are exceptionally customized because of that need.
And I think that helps the healing process
Absolutely.
right along. Well, ladies, thank you for being here. Congrats on your new company, you entrepreneurs, you. I'm so proud of you.
Thank you.
And I think I could use a guide in my life sometimes, not for cancer,
Hopefully
but just
not us.
get me through. Well, good. We're coming up next, actually, we're going to meet a young man who is a coach, and he gives personalized training for anyone who's battled cancer. More next.